In good times and in tough times, the health of Hawaii is always a priority at HMSA. And during the COVID-19 pandemic, HMSA continued caring for its members through the use of telehealth and virtual care, including HMSA's online care.
Many of the doctor's offices, in fact, adjusted their hours or even closed during the early stages of the pandemic. So having online care was life-saving for many people. Luckily, HMSA's online care was there to fill the gap.
Our online efforts led to Amwell recognizing HMSA with its Empowering Providers Award.
HMSA was Amwell's first health plan client over 11 years ago. We were way ahead of our time, but since then we've expanded to provide services for over 65,000 of our members, and then we added 53,000 during COVID.
HMSA has allowed providers to care for their patients in innovative and alternative ways by covering telehealth and virtual care. Dr. Ron Morton is just one of our providers who adapted to those benefits.
So we really started doing telehealth visits around April or so of last year. I think like most physicians and patients, we had our share of glitches at first, but as time went on, patients really adapted to it dramatically. What patients have told me was, wow, I don't have to hassle coming over to your office. I don't have to hassle finding parking. I don't have to worry about sitting in the office getting exposed to other patients who may not have COVID, but other infectious diseases. So I think it's kind of been a win-win.
When Dr. Morton had to go to the mainland for a family emergency, these online appointments helped him continue caring for his patients and kept his staff employed. Patients also avoided the hassle of needing to find another doctor.
The fact that I've been a patient of Dr. Morton's for probably 40 years at least, I feel confident and respect his judgments and decisions. I would probably not feel confident with the new person. And so for me, it's important to keep Dr. Morton as my primary care physician.
I actually like to thank HMSA for supporting the providers even through this time period and supporting the telehealth program.